and twins, identical twins, separated at birth. And there were ones in one country or state and the other ones somewhere else. And they happen to pick the same profession, pick a similar
vehicle,
spouse. They pick similar hobbies. And you know, science can't figure any of this out.
I know it.
Because the answer to all the questions is it is nature and nurture. It is not one specifically or the other. It's both. Science wants so hard to prove it's nature and it's all DNA. When if it's the egg split, fertilized egg split, you have identical twins. We were both in incubators for 30 days, but at 6 months old, Joan had to go in for major surgery. She was sick during this first 6 months of our lives. And as a parent of a child, I am fully aware of what the sickly child syndrome is and the guilt that society puts on you all the way to what you do to yourself. And that Joan got all this extra attention. And, you know, thank you, mommy and daddy, I could say, for all the therapy, but the grown-up Jane knows perfectly well that they had no choice. She was having seizures. So anyway, all that nurture and lack of nurture, even if some of the nurture was poking and prodding, and I can't help but be so in awe that I ended up with a lot of isolated abandonment type traumas, and Joan, through the years, ended up with more poking and prodding.
Okay, did she clarify? I was, because I had the seizure disorder and the brain tumor, they were constantly interventions, medical interventions. So even negative attention is attention still. Jane was wheeled off because she was not sick. And the doctor,
after 2 weeks, I should have been sent home, and the doctor was
but the doctor at that time said, and insurance would never do this today, can she stay in the hospital for 2 more weeks with Joan or whatever? So then the parents could have them not sick. You know, it was overwhelming for our mother
and come home
together. So that in itself, as a nurse, we know if you have a well patient on the floor, they're not getting any attention. So when we did our practice and we had the privilege of seeing hundreds of individuals that had been incarcerated, quite a few of them, half of their lives, the United States has to step up their game here, because we almost encourage people to be in prison, and then we treat them. If they're not sociopathic, we'll make sure they are before they leave. Anyway, we were able to do that. And what I realized at the time was I was sharing symptoms of trauma with men, much more men than a woman. And they were in prison for over 3 years. Under 3 years, and solitary confinement was that one. All of a sudden, because it was annoying in my office, I'm like, you remind me of Jane. And it was the person who had been in solitary confinement. And I'm thinking, duh, poor Jane. She just,
or adopted,
you know, or that kind of trauma.
That.
So yes,
my ex-husband was adopted. I find that interesting. I even picked a person similar to my abandonment stuff.
So unfortunately or fortunately, with trauma, you first have to be validated, because a lot of people will say, no, you didn't go through that. There's a movie out, it's fantastic, that the system pretty much makes this young female believe that she made up the rape in her head. She was like, you know, probably. And it was female cops later. I hate to be like, you know, the guy didn't see it, but it was 2 female cops, and it was based on a true story. That I could be lying about that. I don't know if it was based on a true story. They caught it. But anyway, you know, it's weird. It's a manipulation of the mind. And as we all know, you manipulate the mind. And the point of therapy is, whether it's my own or giving it, you want to recognize habitual patterns. And if those are negative patterns in your life, or unsafe or ineffective, irrational, like me, you know, you want to just help that person, you know, reframe it or move in a different direction. So when you say the pattern of the generational trauma, that's harder. It's because the first person had the chance, but nobody helped them, I guess, to get out of that trauma. But here's the clincher. When I was in school, I had the privilege of a female going back for her doctorate, and she presented her dissertation to us in class. And what I had heard, Vietnam veterans, because it was a big deal. They were the ones first getting the post-traumatic stress disorder diagnosis. And what she had learned was if you had early childhood trauma coupled with adult trauma, there was a symptom that was not even in the Bible, the DSM, where we were diagnosing people. And I heard her and I started to cry. I excused myself out of the room because it was hearing your name being called and nobody was there. Routinely growing up through adulthood, I would be like this. Yeah, nobody called my name. No one, I would never, I didn't really say anything because nobody caught my attention deficit disorder or processing disorder either, or tic disorder. That went through my first master's. Then I guess the treatment was a bit better. But yeah, so that blew me away. So when we had the privilege of treating PTSD, we added that symptom, asked it in the initial assessment, because people often don't know or are unwilling to tell you childhood trauma, because that's usually something people feel ashamed about for some reason.
Or they deny it. In fact, they
might ignorant that
or deny it themselves. I remember because Joan had suffered. I grew up in a household where Joan was sick. The rest of us were well,
or appeared it.
Well, listen, it is so much fun for an hour to a week to a year to attack one or both of your parents about how they did you wrong. It's a lot of fun. But when you do it for 10 years.
And that would be in the practice as well.
When you do it for 10 years like I did, what I found, because every human being has a natural contradiction. You know how they say, doctors and nurses are the worst patients, but they can be great for you. You can have a buddy that gives the best advice, but he has the worst relationships on earth because that. So every human being has that going on, where it's just an obvious contradiction to everybody else, but not to themselves. Yeah. Like I had PTSD, but because I was told I didn't have anything wrong with me, or then I was told I suffered from depression, it was very hard for me. I was told I was the fat twin. And we grew up in the 70s, and I don't know if you've seen pictures of everybody in the 70s. Take a look at everyone at Woodstock. Now, they are a little older than us, those kids, but we were skinny. And I'm called fat. And thank God, eating disorders were not in vogue yet. It was the later 70s, early 80s when they were more in vogue. And because I would have had one, and somebody might say I already have one because I used to be the dieter, and that's why Joan's clients wanted to hear from me. What did I do?
But anyway, yeah, I hope we answered. It was a lot of divorce, infidelity, a lot of bringing up, why am I such a bully at home in a relationship? What's wrong with me? I'm degrading. Is it emasculinate, whatever that is? Just a lot of trauma, but most of which we heard. I mean, still in that old building that I'm talking about back in the 80s, I have yet to hear, I think, Jane had somebody. I was going to say, I've yet to hear something as traumatic as I heard from the individuals that ended up in that building, that they stayed for so many years to get better. Unfortunately, the medicines back then, some of them had toxic side effects. It was really too bad. And then I saw some of them later and it was like, wow, this is really too bad. Like what a sad life, And so what I believe, and the book that I promote, The Body Keeps the Score with Trauma
by Dr. Bessel.
You may think you're dealing with your issues in therapy. You may think that you're dealing with it in life because you seem so well adjusted. But like he said, that body remembers, your body. And, the tics I was having in college, I started stuttering in my 40s. These are obvious signs you're not getting the treatment you deserve. I was hearing my name.
But you were getting.
Oh, yeah. I was getting treatment, though, until when I was 35. So that was, what year was that? 19.
But the point is
I don't know.
You got a little bit better.
Yeah, you do. You get better, a little better. I think therapy is wonderful, especially if you can laugh, because one psychiatrist that I was going for therapy with, we laughed so hard. He actually said, Joan, this is really interfering with your treatment. And I'm like, I don't think so, because what I always strove for, if I don't think that's a word, strived for, who knows if that's a word, was to find somebody in life that made me laugh. I made everybody laugh. And if somebody makes me laugh, they're worth having in my circle. And cousins used to joke that Ted Bundy could be in my circle as long as he made me laugh, but he never tried. So who knows? Who would know?